Well, despite our weather, it's awful. Short season is here.
Yeah, that's right. Any day now, right? But if you have varicose veins, slipping on a pair of shorts or a skirt may be tough for you. But other than appearance, untreated veins can cause medical problems and skin changes too. Allure Medical treats these conditions, getting to the root of the problem. Dr. Charles Moak is the founder, and he's here with more. Great to see you.
Good to see you. Thank you.
I think this is a thing. This is not a summer problem, but we tend to talk about it more as we get closer to summer because that's a time when people want to be wearing shorts or cropped pants or skirts.
For sure. So there's different stages of this disease. The common one that people think about are the spider veins or the purple veins or the varicose veins, but it's actually a much bigger scope than that. And when we started treating veins, that was really our target, was people that had, pretty legs, but they had something ugly on them. And now we're seeing a development to patients that have not just discoloration from spider veins, but actually discoloration from the circulation not working properly.
It looks so painful, these pictures.
What are we looking at here? Is this a progression or is this just different examples of problems?
This is progression, but people might jump from one to another. So typically we'll see minor veins, spider veins, varicose veins, but if they're left untreated and if people have symptoms like swelling or heaviness, they'll actually get worse at about 4% per year until eventually they get brown spots and discoloration, redness, scaling, and eventually they can even get an open sore. So if you get to the point where you're having significant symptoms such as pain or swelling, that's time to get it looked at.
Okay, and you guys are coming from Detroit. You decided to expand in Milwaukee. Is there a need here, or why Milwaukee?
Yeah, so first off, it's close to us. We like Milwaukee.
Okay,
we're used to the weather.
Right.
And we have a similar season, obviously. So the reason for Milwaukee is we looked at different areas of the country that were easy for us to get to that had sort of like an under-penetration of what we do in the marketplace. So we looked at the number of people that were going into wound care, which is the end stage of leaving these untreated, versus are we doing the modern treatment or not? And then we select the practice and move in there.
Okay. It seems like it would save healthcare and save people a lot of money if you can treat this earlier rather than waiting until it progresses to the point where it's not just very unattractive, but a sign of a real medical problem.
It has massive implications on healthcare costs. When people do let it go to the end stage, so they get the sore, it costs about $96,000 over 4 years with traditional healthcare, which is wound management. We can treat this in like less than a month and it's gone for good. So it has huge economic impact for health insurance companies, but for people it has a massive impact on their life and their lifestyle, not going to
their quality of life.
Oh my goodness.
Absolutely.
Yeah. You feel better, you look better. So what kind of treatments are you guys offering?
Yeah, great question. So we do an ultrasound first, and this gives us a three-dimensional look at, like a roadmap of the veins, and we find the ones that aren't functioning properly, and we use a device that generates heat and energy and actually burns it. It's painless. We numb you up first, and it burns a vein that's not functioning properly, and it reroutes the blood to the healthy adjacent veins.
Now, in years past, people would talk about stripping veins, and it sounds horrible, but it seems like things have come so far and that you can do it because the picture we saw was just somebody having it done in office.
Oh yeah, you're totally awake. You don't need to take pain pills for it. You don't need to do anything afterwards. It's not like stripping where you have a surgery, get knocked out, have to wear compression afterwards. This is an outpatient procedure, and you're right back to work the same day.
Are you treating the whole, are you treating just spot treating? Are you treating the whole leg if it's swollen?
That's a great question.
What do you guys
there's
look
usually,
for?
well, there's the ultrasound tells us, but usually there's one or two veins that fail. They've got valves in them and they just stop working. And when the valves stop working, the blood wants to go the wrong way and starts building up and it starts growing new veins. So we find the root cause vein first and we treat that. And usually there's one or two treatments afterwards to kind of clean up the branches.
Okay. What separates you, do you feel like, from other people who treat veins? Because I know you were known as a leading vein specialist in Michigan. You're bringing that here to Wisconsin. What differentiates you, do you feel?
Well, that's a great question. First off, it was doing it non-surgically. So I think that's kind of the standard of care now everywhere. But really what differentiates us, so we have a tremendous amount of experience. We've done over 100,000 procedures. So we have a lot of doctors that we can bounce things off if there's a difficult case. We could do it very fast and efficient. We make it very easy for people to look and feel better with less risk.
It's amazing how quick it can happen.
Yeah. So when it comes to insurance, how much of this is cosmetic and how much of this is like, a serious health condition?
Yeah, that's a great question. So when you just have it where you want to wear a skirt and make your legs look better, that would be cosmetic.
Okay.
We're seeing mostly patients that have swelling and heaviness. So typically if there's symptoms that somehow affect your quality of life, or if you have discoloration, brown spots, scaly, those are covered by insurance. So the majority of what we do is the non-cosmetic part of it, and it's covered by insurance almost all the time.
And if people come in to see you, you can tell them if they're a good candidate for this laser treatment for veins?
Oh, absolutely, yes.
And you do that with the diagnosis using ultrasound?
Ultrasound lets us look right, it's a beautiful tool. We can look right through stuff and see what's under the hood.
That's
pretty
great.
amazing. And we're talking age. What age limit are we talking about here?
There's really no age limit. We
ages.
see this typically, I mean, the average age is about 57,
Okay.
but there's, 20-year-olds and there's
Sure.
80-year-olds.
Okay.
It's wonderful. Thank you so much. People can get more information, schedule a consultation, see if you're a good candidate for vein treatment. You can get a free vein screening at Allure Medical. You can visit their website. It's alluremedical.com, or call this phone number today to set something up. It's 262-239-7399. Great to see you, doctor. Thank you for your time.
Thank you
so
very
much.
much. Thank you.
Appreciate it.